questions. I'm Rick Heck from Sac County.
Scott Jacobs, Calhoun County.
Neil Bach, Carroll County.
Go ahead.
Jeremy Taylor, Woodbury County.
I'm Kim Buryanik. I'm the Associate Superintendent for Sioux City Schools.
Dennis Butler, Woodbury County.
Diana Osman, Iowa Services Inc. Pat Larson, Howard Center.
Pitts Grant, Sanford Center.
Gina Moyer, Sanford Center.
Chris Dam, Chesler Hall.
Jim France, representing ARC of Woodbury County.
Ashley Miller, Plains Area Mental Health.
Lisa Bringle, I'm a coordinator with the region and cover Cherokee and Buena Vista counties. Lisa Mayer, and I'm a coordinator with the region and cover Sac and Calhoun. And there is coffee ready.
Melissa Drake, Plains Area Mental Health.
Don Menzer, CEO for Rolling Hills.
Louise Galbraith, coordinator, Carroll Crawford and Ida counties.
Sandy Dingle, Genesis Development, Storm Lake.
Kim Kelleher, Plains Area Mental Health.
Nancy Timmons, Mental Health.
Sheila Martin, Siouxland Mental Health.
Joel Peterson, Siouxland Mental Health.
Kaylee Nelson, New Hope.
Lisa Meyer, West Golden Street.
Deidre Brown, Lakewood.
Sean Fick, the Globe Great Plains.
Thank you.
We got a couple.
Yep.
Paul Martin, Beaver County Supervisor.
Dennis Bush, Cherokee County Supervisor.
Cecil Bloom, Crawford County Supervisor.
Preston Schubert, Ida County Supervisor.
Minutes were sent out previously. Have you not had an opportunity to look at those? If so, I would entertain action on them.
There's also a copy in your packet.
I've reviewed the minutes. Found that for your representative meeting, I'll move to approve the minutes of the September 9th meeting.
Is there a second?
I'll second that.
Two, thank you. Motion's been made and seconded. Any further discussion? Hearing none, I'll call for the question. All in favor indicate by saying aye. Aye. Motion carries. Any need to add or change the agenda?
No changes.
I would entertain a motion to approve the agenda as presented.
So moved.
Is there a second?
Yeah, I'll second.
Motion's been made and seconded to approve the agenda as presented. All in favor indicate by saying aye. Aye. Motion carries. Anyone here today, we always keep a slot for comments from the public. Limit those comments to 3 minutes per individual. Anyone like to speak today? Go ahead.
I just have a real quick comment. The Rolling Hills region started running the iStart program, and we took advantage of it at Genesis, had Jim Egbert come and talk to all of our staff, and probably about 2/3 to 3/4 of the staff actually came, and he talked about how we work more effectively with people with disabilities. He did a couple rundowns with different scenarios with some of our folks and services. Didn't use their names, but used some techniques that we might be able to use. And it was so effective because he used real examples. It wasn't this great big overview of this is what the world should look like. This is how you can help change the world you live in right now. And it was very effective. So I want to thank you guys for funding the iStart program, because we did take a benefit for our organization as well as the individuals in services. We have now applied to have services with iStart with them.
All right, thank you.
Well, thank you.
Pat?
We also have used iStart, and Jim Egbert came to our agency, and we are working now with one individual with iStart, and he's coming back a couple times, and the staff, it's been great. It's been wonderful, so thank you. Given our staff a lot of positive reinforcement.
All right, thank you. Anyone else? Seeing none, we'll move on. First bullet point being old business, legislative forum discussion.
We decided at our last meeting to reach out to Senator Sagamart to confirm a date with him before we would schedule with all of our legislators for a forum. And I just heard back from Senator Sagamart late last week that November 21st, which is a Wednesday, works for him. And obviously it's pretty critical that we have him confirmed before we reach out to the rest of our legislators, because he serves on the fiscal liability study committee for the regions. And so November 21st, we just need to pick a time. I also contacted Jamie Cashman from ISAC, and he is confirmed for that date as well. So we just need to decide format and a time, and then probably a couple of board members and myself and staff and sit down and decide what the main focus is going to be and topics. And I know in years past when we've done the forum, providers have attended, and any burning issues that they want to address with legislators, we allow them to do that as well. So we just need to set the time and the format, and then I'll reach out to the rest of the legislators in our region.
When you refer to format, do you also have a location in mind?
This is a nice location. I don't know if it'll be available, but no, I have not picked a location yet. That we need to decide the logistics, whether we want to do morning, afternoon, or a luncheon forum. I know, Cecil, in the past you've mentioned that if you feed
them, they seem to come.
So that might be something we want to work on. I just thought we should confirm the date and time, and then all of those logistics we can, work out the details here within the next week and get.
Are we going to do a monthly meeting the same day?
Yes, that's what we need to do, instead of having you come back twice.
What was the date?
November 21st.
Any discussion about that? I think it's really been effective for us in the past, and we certainly need to exercise our in with Senator Sigobart. He's been in the system a long time, and as far as mental health as a supervisor, and I think we need to utilize him as best we can. Board, have any other comments as far as what and when?
Well, if we start with the luncheon, we got a little flexibility for the late arrivals. Maybe start with the luncheon and have the business meeting start, luncheon at noon, and start the meeting and everything else at 1 o'clock or 1:15.
This meeting or the forum meeting?
Well, I would think that we could do the forum first and then just roll right into the meeting.
I would agree. Anybody else have any other
Works for me.
comments?
Works for me. Sorry.
Okay. All right.
At the meeting before the forum, we could strategize a little bit, the meeting for the forum too. I'm just thinking about switching them. But just thought.
Don, you have any preference?
It doesn't matter to me. I'm flexible, so. I mean, if we have a noon luncheon with the legislators, they'd be done eating by 12:30, 1:45. We could do the forum. That could be wrapped up by 2 o'clock, and then we could go into our regular meeting. Otherwise, we could do 10 o'clock board meeting and then the luncheon with the legislators, so it does not matter to me either way.
What's the consensus of the board?
I suppose cocktails are how it
I don't think that was part of it.
Oh, okay.
What's the consideration of
Well,
it?
should we have just a couple people and work it out with Don? A couple board members?
Okay. You willing to serve, Paul?
Well, sure.
I will as well.
Okay. We should probably meet here within the next week. I know the forecast is snow and rain, so maybe there's a date. Sorry, I hate to tell you that. You probably know it, or knew it before me. But if we could work out one of the days where you can't be in the field right away, that we could get together, because we probably need to get notice out as soon as possible.
I agree, because the timeline's kind of tight now.
It is.
Okay, we can discuss that later.
We'll talk about it after the meeting.
Okay, sounds good. We'll move on. Stepping Stones update, Lisa.
Hello. So for this fiscal year, starting in July, we've had Stepping Stones has had 9 admissions, 62 since we opened, and 9 discharges, 55 since we've opened. The bed days for this fiscal year are 731, and we've had a total since opening of 4,831 bed days. We are at 15 referrals since July and a total of 132 referrals. We currently have 7 individuals, 2 of which are getting ready to move out. So we have 5 on our waiting list and 2 that are ready to move in. So once those 2 move out within the next couple weeks, we'll move 2 more right back in. The referrals since July have been 3 from Turning Point, 1 from Plains area, 4 from the Manning Recovery Center, 1 from the region coordinators, 1 from St. Anthony's, a family member, and then we've had 4 others, lawyers, probation officers, Job Corps in Denison, and then St. Gregory's referred an individual to us.
Any questions? Thank you, Lisa.
Thank you.
I just got one quick one.
Go
Have we
ahead.
ever had a day when we don't have a wait list?
No.
One other one I guess I would ask is what are you aiming for length of stay and how are you
It's
doing with
still,
that?
it's not, when we opened, it was 90 days. That's not enough time. So we're still in the 120 day range is what we aim for. And we have one right there right now that once they stay longer than that, we see it's just too long. So we like to keep it under that 120 day.
Okay, thank you.
Thank you.
Next bullet point is Turning Point. Ashley?
Good morning. We have served 68 clients for 2018. We've served a total of 236 clients since opening in February of 16. Our average length of stay is going down by year. We're at 10.4 for 2018. Our average daily census for 2018 is 2.68. We have had a steady increase since September in our average length of stay since August. We were 2.9 in August, 4.1 in September, and 3.76 for October thus far. We have for 2018 total beds used is 630. Total beds unused is 1,762. We have billed out $187,000 in claims for payment to the MCOs and the IME. So we need to receive payment on those.
So you haven't received any?
No, not yet. We've had a lot of kinks with the claim process, so I think that we're getting it all smoothed out. So hopefully we'll start receiving payment soon. And then I've been keeping track of our referrals that don't admit. And we had 41 people that we accepted, but they did not admit, and then 53 that we have denied based on court order, substance abuse, or homelessness. And I also track the trends of our readmissions since we opened. And in 2018, our readmissions have gone down in comparison to 2016 and 2017. So that's something that we hope to continue to improve upon, people needing to readmit to the program.
Are you still pursuing the avenues to attract clients?
Yes. Yes, we are. And working with other regions as well. We try to coordinate with them if they have a need and we have the bed availability. So far it hasn't stuck yet, but we're still working at it.
Okay, any questions for Ashley?
Any idea when you expect some payments from the MCOs? I mean, it's been quite an ongoing deal. Well, first they didn't have everything lined up for you to even apply, and now you're applying and not get paid. Go ahead, Kim.
Well, we had to reconfigure our electronic health record because it's a completely different form that we had to use to bill. So that took time and expense. And so we've got that figured out, and now it's just submitting all that back stuff clear to February. Ashley had to submit volumes of paper, basically, in order to get these claims paid. So they're still reviewing some of that paper. And then also we had the wrong code. We were told to use one code, and now it's the wrong code, so now we have to resubmit. So and I think Seymour Mental Health Center can attest, it's been a horrible procedure to get through. So we're hoping in the next couple of weeks that we can start getting paid.
How far back are you going to go?
And that goes back to February.
But Kim, with those, the 187,000, isn't that based on the full amount of days that the person was there, and you have the 5-day services that MCOs will pay, and then
Right.
there has to be prior authorization after the 5th day, so they're not gonna pay the full 187,000 back to you.
Probably not. That's what we have billed, that's what we've billed out. So we're hoping, 75% of that. But that is what Ashley is working with United Healthcare on, basically, is that review beyond that 5 days.
And we've received all of our authorizations for back payment from Amerigroup. They've approved all of our back payment. And United Healthcare, a few. I'm still waiting to hear back on, I think, 6 people. And I have a meeting with United Healthcare next week to talk about claim submission and things like that. Any issues that we're having and struggles with that.
All right, thank you.
I have a question.
Go ahead, Susan.
Ashley, by your numbers, it looks like you're running about a third of occupancy. Going forward, and I know you've been trying to shake the bushes to get more people through the facility, but long-term, is a third full sustainable?
No, our goal is to be at an average of 4 people per day, is what I believe Brenda and I came up with for a number as our goal that we're trying to have as an average per day for sustainability. So October thus far, we're at that goal. September, we've met that goal, so we're hoping to continue to improve upon that. And continue to get people in.
Okay,
So,
thank you.
Yep.
And we've continued to do marketing. We'll do another marketing push probably in January and February. And also, I think we need to have a meeting with the telehealth partners, because they were not making any referrals to us when people were going to the hospitals. So I don't know if Ashley, if you and Melissa have met with them at all, but there's just a lot other things that we need to stay on top of too.
Okay.
That one is huge.
Yeah,
I met with Jay Ricky following our last board meeting, when we were over in Lake City, or Rockwell City for another meeting, and expressed my concern, and he did follow up on it, and essentially, there was a breakdown somewhere in the communication as far as the information being given to all of their providers about Turning Point, but they denied ever stating that they guaranteed a 50 to 75% deflection rate. That was never a guarantee, is what they said.
It wasn't a guarantee, but that was the discussion.
That was the selling,
Yes.
selling point for us.
Yes.
They're not even hitting close to the mark, so.
And we've seen a decrease in the amount of referrals that we've gotten from hospitals since ITP. A very significant decrease, especially from our hospitals that, like, for instance, Cherokee, we used to receive a lot of from their ER. We still receive some from their med-surg unit, and Crawford, we have seen a decrease as well in those two hospitals.
The ITP connection, I mean, they're the first,
Frontline.
and I do too really remember the discussion of the 75% deflection. That stuck with me, and we're not remotely getting to that point. So you have had that discussion
Yes.
with them.
Ashley, when you've reached out to other regions, what kind of response are we getting from them? That kind of disappoints me that I know does every region have a facility like we have?
They have a facility where they contract with another facility in another region. So our most popular is, I have a close relationship with the director of the crisis home in Southwest Iowa region. So whenever she's full and she receives another referral, she contacts me, and we try to figure out if the individual would like to come to us, if we can help them out. The concern is if they don't have insurance. If they do, we haven't been billed yet, so I've just asked for an NOD in the event that they don't have insurance, or in the event insurance denies, and they haven't wanted to provide that. So we're still trying to work it out. We have, well, they're gonna start monthly crisis home director meetings in Ames. Melissa and I weren't able to attend the last one. And that's one of the topics of discussion for next month's meeting, is how we can assist each other and get through that barrier. Because when other people are full, we should be able to assist them. It's about service.
Are our rates to non-county members too high? Maybe,
No.
no?
Compared to others?
Yes.
Southwest Iowa region just raised theirs to 730, right? Because they were getting such an influx from out, from the region that they contract with, and they were extremely high needs, and homeless, so it was taking a lot more coordination and staffing, to assist those individuals, so they just increased their per diem.
We started and supported this program for the deflection, and obviously, you know, that's been a disappointment, and so I really think that's where we need to start.
I think there's also very unrealistic expectations from getting people hooked up to services in 5 days as a coordinator. That's so unrealistic. There's no way. Most of them have housing issues. Most of them have never been hooked up to psychiatric or therapy service or substance abuse services.
They don't have
They don't,
insurance.
yeah, they don't have Medicaid. And when Medicaid takes up to 45 days and they have no meds, then who's gonna pay for meds?
It's a good point.
At our last meeting, Ashley has reported that ITP didn't have the information to make referrals, and it seems now that your referrals are going up, and that had been corrected apparently. Have you been getting many referrals from ITP or not?
No. I did email Jay with my concerns after talking with Crawford County Hospital. And I also emailed them our referral form so that they could distribute that again. I haven't spoken with him. It was only through email exchange. That week that we did that, we did receive multiple calls from ITP, but they were from out of our region, requesting our information. And then we've had one.
I had one call when I worked the house, and then she ended up coming the next day. They called to ask if there was a bed available. It was like 9 o'clock at night, and I said yes, and then didn't hear anything back all night, and then that next day she was actually referred out of Crawford County.
They referred
So
her the next day.
ITP did use us then, and I think
In the last week.
it's been twice.
Stewart Memorial utilized ITP and referred someone to us.
Well,
Horn Memorial
I
didn't.
worked with Lake City Hospital that night to remind them of the crisis house again. And
Well, and we're actually going, Ashley and I are going to Stewart Memorial on the 21st, because that meeting in Rockwell City, we had, I think, the head of the ER and everything. They said they have kind of somewhat maybe forgotten, because now they have ITP, so they've been so focused on that. But they've had individuals they thought that had come in, and they've had an ITP evaluation done, but they said, we don't necessarily know if it was needed. We could have probably almost just referred them ourselves to Turning Point. So we're going to go back, and they have a med staff meeting on the 21st at 7:30 in the morning. So we're going to go to that, and I think that's maybe where we're going to also go with all the other hospitals. Just to remind them that you can still refer people. You don't have to always use ITP on every single person that comes into the ER.
It seems to me that it might be fruitful to have a face-to-face with ITP.
Mm-hmm. And we can set that up.
Okay. Any other discussion? Hearing none, we will move on. Next bullet point is FY19 supported employment grant update from Genesis, Crossroads Ida Services, and Howard Center.
Okay. Just for Genesis, this last quarter, we placed 3 individuals with jobs, and they're averaging 18.33 hours per week at their new jobs. And their wages are averaging $8.84 an hour. So again, I look at this way more than minimum wage, and our goal is 20 to 25 is what we really hope for full employment. And we have 18.33 hours per week. So we're not quite at that full employment yet, but we're making good strides toward it. We have about 30 individuals that have jobs in the community right now. And we've already placed 2 new individuals already this quarter, and they've come through the school systems. So we've had our ACE program that's in the school is called EBCE, and they've come from those programs where they had internships at these different businesses. And the businesses said, hey, you've done a great job. Do you want to keep going here and actually have a paid job here? And so that's how they've gotten their foot in the door and then gotten that reference, and everything's going really good with that kind of program. We have more than 45 businesses that we have partnered with in the community, of Storm Lake and Alta and things like that, that will do internships with our folks. And that's a great, again, way to get our foot in the door and have that recognition with the folks and services that might want jobs in the future. So, what else do you want to know about it? That was quick. I mean, that's a great job.
Very good job.
We appreciate the help. I mean, we really do. We wouldn't be able to have these job searches without the extra income and things like that, because it's not part of what we're getting paid for. So, thank you.
Ida Services or Howard?
Yeah, I can go. I'm pleased to say now we have 100% of our employment services is done out in the community. We don't have any in-house work at all. We have 7 people placed at their own jobs, and there are 9 on small work groups, and we have a variety of work. The employers are really open to that, and we're getting more and more employers contacting us. And we're working with the school, and we've gotten a few people that want work, and that's through the school and IBRS too. So it's really wonderful. Let's see, Arnie's got averages. On average, folks work 13 hours a week. And the average wage is $9.24 an hour, and the starting wage is $8.81. But our staff have been doing an outstanding job, so thank you for helping us out.
We also had an increase. We've increased our enclaves a lot. We've had 6 people on our enclaves where we had 2 at the beginning of the year. And we have 1 person that works full-time at Farnabakken and Carroll that we provide services to. The enclaves, they're working about 5 hours a month, and $7.48 is their average wage. And we did find a used van, and so we did purchase that from Beckman's in Oldboat. So thank you very much. Appreciate it.
And then for Crossroads, I talked to Teresa Magnuson yesterday. She could not be here, but they have placed 1 person this past quarter. And the incentive funds that are part of our contracts with our providers, Genesis had their 3 placements that they billed the region for, and then Ida Services, you didn't have any.
Not yet.
As far as job placements, it was Crossroad had 1, and so yeah, we're starting to move towards the incentives. And then we talked to Sandy earlier about we're going to put in some type of employment verification process, so that just for accountability purposes, so that when we receive the invoices, we have something signed off by the employer verifying the length of time the person's been employed. So.
All right, thank you. Rolling Hills Advisory Board update.
We met on September 27th, and a lot of discussion around the crisis services, the new band-aids, how is this all going to roll out. Still a lot of unknowns. Definitely looked at our existing services, what the gaps are. As we discussed before, transitional housing seems to be a huge need. So we might want to look at additional transitional housing. Other than that, just keep attacking the new mandates, and crisis services is one thing that Plains area, we will be meeting this afternoon regarding mobile crisis, and hope to have a proposal to you by your December meeting. So other than that, just kind of monitoring services and how to implement it all. So.
Thank you, Kim.
Have you got much feedback from other regions? I know some things we thought we couldn't do as a region. We have to cooperate with other regions. Have you got much from other regions?
Well, I think, yeah, at the last Sioux Rivers board meeting, and Dawn was there, you know, it's obvious that they all recognize, especially for the access centers and maybe the ACT teams, there's no way that one single region can afford to do it on their own. And so they're going to have to collaborate. And I think Dawn is meeting with them regularly. You know, the access centers, there's a lot of variation in how people feel that they should be implemented within this coalition of regions. So I think that needs to be worked out. Some think it can be provided virtually. I happen to disagree with that. I think it is a brick and mortar system, and I don't think it can be done virtual. So that's
Right, and I would agree with that, Kim, and that's where my struggle is, because the regions that I've been collaborating with, the other four, I think I'm kind of the outlier. I think it should be a facility where someone is taken and dropped off, no eject, no reject, and they are triage served by whatever level of care they need. And the other four that I'm collaborating with think it should be a virtual service network, which we already have a service network established within our regions currently. So I unless I'm missing something, I don't agree or
I
understand.
can't wrap my head around that.
I can't either, Kim. So
to me, that's what we have now is the existing central point of coordination system with all access points being our services, our providers.
Right.
Well,
I
I think the legislature intended that it be an actual facility that people are assessed and then moved to a necessary level of care.
According to your last meeting, tents of residential homes was top priority, and a couple people, Genesis and Wesco, said that maybe will help, but they didn't have finalized rules and detailed funding agreements from Medicaid and MCOs. Has any of that been made?
And the rules aren't
It's
final.
still no reject, no eject,
Yeah.
kind of tickler that's holding some things up for the Irish homes, to be honest with you.
Yeah, and as far as those intensive residential homes, I think for our 5 regions, we identified we could probably serve maybe 4 people in a home, and that would cover our 5, because these are really intense, complex needs cases, and I don't think that Rolling Hills currently would have anybody that would meet that criteria. So.
That's the downside of doing bricks and mortar, or the consideration of duplication, and you staff a bricks and mortar situation, and then, like in our case, we really don't have anybody currently that would need it. So that's always been a concern of mine from the start when they implemented this thing.
I want to just jump in here a little bit. The rules aren't written yet as far as any of the services that are required in 2456. The proposed rules were published. The comments have received a huge amount of comments. We had over 300 comments submitted to DHS. There were so many comments that there'll be a public hearing held in Des Moines in November on the proposed rules. Been a lot of discussion. The access centers, I know they were the intent of the legislature and the thought of the commission is that definitely is going to be a brick and mortar structure. The intensive residential services will be a brick and mortar structure. ACT teams and mobile crisis, it seems like there's a fair amount of support that rural regions will not be able to fully staff those kinds of programs without some type of of a virtual, internet access, or that you're just not going to be able to staff people out there. So, but the final rules, there hopefully will be adopted in December, but we're still trying to figure out exactly how we're going to do it.
Thank you, Dennis. Anybody else?
Don, do you want to discuss any more about that, the Children's Mental Health State Board, when they're asking the regions? Is there still a big push for that?
I think the report from the state board is due to the legislature November 15th. Is that the date? November 15th. I have not seen the report, but I don't think, as far as my update last month, I have not heard anything different. I think that we are going to be involved in some manner, but to what extent, I don't know at this point. And it's due to legislature. Dennis and I are of the belief or mindset that there could be a bill coming out for the children's system at this next session. And just wait and see, and hopefully there's funding attached to it if the regions are involved.
Okay, we will go on to the new business section. Iowa Community Assurance Pool grant awards.
I met with two representatives from ICAP late August, early September, and throughout their risk management assessment that they did with me, they also came down to Turning Point and walked through the house because it's insured under our plan. And they let me know that there is $1,000 in grant monies available through our, just for being an ICAP member. So I reached out to Turning Point and Stepping Stones to see if they had needs to make their facilities more safe and secure. We applied for a grant for Turning Point in the amount of $430.68 for front and back door alarms, exterior lighting, and backyard fencing. We received that grant. And then Stepping Stones applied for the remainder of $569.32, and they are going to put that towards the purchase of an AED. So we used our $1,000 in grant monies, and Stepping Stones is going to take care of the remainder of the purchase of the defibrillator. But we were able to use that and help our providers. So, and it was an easy process. I've never seen a grant application this easy to complete. One sheet. I sent it in, and within about an hour, I sent it to the committee, and it was approved within about 5 days. So I was really pleased about that. So.
Good.
That is an annual grant, I think.
Yes,
so
I found that out.
It'll be available next year as well. And our county uses it every year.
That's great. I didn't even know it existed until they came out to do that risk assessment for the region.
I think Calhoun County gets 3 of those for each one that's insured with ICAP, each division, so it's probably side to keep an eye on that.
All right. FY18 Rolling Hills Annual Report.
Okay, I sent out the annual report with your packet, and I only copied out for you the data that really is probably of most interest to you, because the majority of the report is just informing DHS, the legislature, and the state of the outcomes that we have achieved as a region, which you are aware of because of our meetings. And so I put in the individuals served into your packet, as well as expenditures, revenues, and levies. And so I'm just going to summarize quickly what is contained within the report, because it's a very lengthy report. Obviously, I don't know if you've had a chance to really get through the entire thing, but I'm just going to highlight a few things. For total persons served for Rolling Hills this past year, there was 1,144. 1,037 were individuals with mental illness, 44 were individuals with intellectual disabilities, and 13 individuals had developmental disabilities, for an unduplicated count within a region of 654. The vast majority were adults. We had 50 children that we paid claims on, either for commitment costs, crisis evaluation, or service coordination, so minimal. Expenditures for the year were $3,452,996. Our accrual fund balance for the counties and the region was $4,250,685. And total county levies for fiscal year 15 was $2,937,213. So we were able to decrease the fund balance from the prior year. As far as outcomes of our strategic plan, I included all the stepping stones data. Lisa Meyer provided me some really good detailed information, testimonials, as well as pie charts that I could insert into the report to show utilization and outcomes. They had 68 referrals, 2 stepping stones in FY18, 32 admissions, 29 discharges, and I just appreciate, Lisa, all the information that you were able to provide for the purpose of the report. Also, I included block grant data from Plains area because of the amount of money that we pay for med management, consultation, education, so that is also contained within. And then when we contracted with iStart, I just included information about the proposal as well as and just a small summary because we didn't actually implement our iStart until April of 2018. With our kickoff with all of our providers, and Kieran Waldheimer was hired to do our iStart program within Rolling Hills. She's housed out of the Sac City location. And then also our support employment block grant outcomes as well as our jail diversion statistics. So lots of information if you are interested in perusing through the report. I also added, because last fall we did our Senate File 504 Community Service Plan, and we've made some good strides towards implementing some of the services we identified as priorities. And obviously, some of the outcomes are, since we developed that plan, we contracted with ITP for psych in the jails and our emergency departments. There's also been an enhanced marketing of Turning Point through these really nice flyers that they developed and have been distributing, as well as using social media for marketing. And I know that Melissa and Ashley have been out to our clinics, our hospitals, and have been doing that more regularly now, so I'm pleased with that. We also sent 1 law enforcement officer to be CIT trained, which is crisis intervention training. I'm hopeful of that at some point we can expand that across all law enforcement within our region. We're kind of waiting for our mobile crisis meeting with law enforcement to be scheduled because we're going to bring a law enforcement officer from Dallas County who's very invested in it up to our region to talk peer-to-peer with our law enforcement in hopes that we can move that forward. And also mobile crisis response, which Kim touched on briefly earlier. So we're hoping to have that implemented by March of this year. And then, of course, we developed this plan, and then on top of that, the legislature dictated what we are going to be providing in terms of crisis services. So we have our 504 plan we're striving towards, and also our crisis services within this next couple of years. So, questions about the report?
Lisa, anybody else have any questions? A lot of information and a lot of effort goes into this, obviously.
I started working on it in July.
Did you?
Yeah. So that I could have it done. It's due to DHS by December 1st, so I will need the report approved.
Okay. I would entertain a motion to take that action.
So moved.
I have a question on this first. On the very last page, county levies, what Carroll County above the 3267?
That's what you levied to be able to meet your contribution for the region. The 3267 was the equal per capita contribution, but because your fund balance had decreased, you had to increase your asking in order to be able to provide that 3267.
You're not providing any more to the region.
No.
It just reflects your local levy to.
That's where the
provide.
fluctuation is within the individual counties.
Right.
And because that looks confusing, that's why I added that statement that it was an equal per capita, because it does look like one county's paying more than the other.
And
But
all
it's
it
not the
does
case.
is reflect fund balances that you had
Correct.
available in whatever figure that you felt was appropriate
Right.
to be able to make your contribution, so. Any other questions? You okay?
Thank you.
You bet. I had a motion to approve the document. Is there a second?
I'll second.
Who made the motion? I'm sorry.
Cecil did, didn't he?
Yeah.
The motion's,
Dennis?
yes, motion's been made and seconded. Any further discussion? Hearing none, I'm going to call for the question. All in favor indicate by saying aye. Aye. Opposed? Motion carries. Thanks for your work on that, Don. Our next section, it's Woodbury non-core funding request proposals and information. My intent today is that we receive these proposals, allow questions to be asked. It will take us a period to evaluate those, and then we will ask Don to make an aggregate of what the requests are, and then we will have to come back and decide in December what we can fund and what we cannot. So that is the intent for today. We will receive the requests. Those that are presenting be available for any questions that the board might have or anybody in the room. And that's how we intend to proceed. So, okay? First one being Chesler Hall.
I know it's a hard thing to say, but I'm Chris Dam. I'm the executive director of Chesler Hall. There is a typo here. It's supposed to be women at risk of homelessness. They're not actually homeless. Well, my emergency beds are. Basically, I take in women, and I'm going to address you. I'm transitional housing that we need more of in the community. I am full with 19 women. We are taking women that struggle with chronic mental illness. Many of these women come from apartment complexes or stability center, hospitals, court ordered from psychiatrists in the region because they can't live in their own apartment. They could be hoarders, anxiety, paranoia, schizophrenic. They then come to Chesler, and I'll explain Chesler. We are like a boarding house. We serve dinner, we have 24-hour staff, we do med management, and ensure they're taking their meds and going to their doctor appointments. I have 15 single rooms that rent for $605 a month. That includes all of their food and services. Those rooms do qualify for Section 8. But even with the rental money, I still rely on probably about $100,000 in donations. If you just take my operating budget, which isn't much, $270,000 a year, divided by 19 residents, it's roughly $1,200. It costs double than what we're actually getting. Mike Woods was instrumental to go to Sioux Rivers and get a per diem per resident. So I'm asking to continue the per diem of $924 a day, which roughly the highest maximum cost would be about $64,000. Without Chesler, I don't know where these women would wind up living. I service probably about 20 women a year. The average stay is about a year and a half. We wrap services around them. Sula Mental Health is probably one of the biggest providers. We get them in IHH, we get community support, we get them on their feet, taking their meds, getting them stabilized, and usually then they move through in about a year and a half. Although my next proposal, we have questions on the core program first before I go into the emergency beds. Do you guys have any questions? Okay. I have 2 emergency beds. These are for literally homeless women that are staying in a shelter in town. I get state money for those 2 beds. Rolling Hills still was, or excuse me, Sioux Rivers was still paying the $924 per resident. My problem with the emergency program in Sioux City is they have to be literally homeless. Many of the women that I get called on are currently living with a family member. Maybe their mom has passed away and they now can't make it on their own. If they were living in their own apartment and they wound up in the hospital because they called 911, they're literally not homeless, so they can't come into the emergency bed. Or let's say they're in a nursing home now or a group home and they need more kind of independent living. They now don't qualify for nursing home care. I can't take any of those people into the emergency beds until they then would get, payment or, the ability to pay. So what I'm proposing is 20,000 a year would be 10,000 for the first July to January, because I've already applied for the state money for 2019. So that Rolling Hills has these beds. Through the state, they can only stay 90 days. So some people that are trying to get on disability really have no choice. If family won't take them in, they wind up having to go live at the Gospel Mission. So, you know, if we're really talking about mental services, getting people stabilized on their meds and getting them on disability to eventually move into their own place, I was proposing that Rolling Hills would have these 2 beds, so when you are in a hospital in the region and you need to get somebody placed, those beds would be available. I think that's it. I think most of the information is there. If then you own the 20,000 for the emergency beds, then you would obviously subtract 2 FTE, because those 2 beds are in the 19 at the 924 per diem. So instead of my funding being at 64,000, it would increase it to 77,000 if obviously every bed was filled for 365 days. So it's an increase of 13,000 instead of 20 for the beds, because you wouldn't be paying a per diem for the 2 people that were in those beds. But I will be honest, before we got the money from Sioux River, Chesler was scheduled to close, because we're sponsored by the United Methodist Church, but donations, as you know, keep going down. We have an annual sleep out, which I'll plug, is this Friday if any of you want to come down to Explorers Field and participate. And so, you know, there is no other home in the area that women can kind of come and go and live independently. And we do the med management, 24-hour staff is always there. We cook for them, they're assigned a chore, so they still get in the habit of, you know, cleaning, so that they can eventually transition with support services around them back out into the community, into an apartment. Some of these women have been banded from apartments in town for 3 years because they had somebody take advantage of them and move in. They lost their Section 8. As you know, Sioux City doesn't have a ton of income-based apartments. There's waiting lists. Oak Leaf has over a year waiting list for anyone under the age of 55. So this is a reasonable place for them to live, those on disability, because their rent with Section 8 is $455 a month, and that includes food, wireless internet, cable, all the services they need. And they're in a community environment. So, you know, we celebrate holidays. Many of these people, their family and friends have walked away from them. So some of them have been there. I have a couple that have been there 10 years, while others move on after a year, and some only stay 6 months until they can find an apartment to move into. So.
Thank you.
Thank you.
Any other questions?
Yeah,
Go ahead.
one. Do you actively work to transition them, or is it kind of at their own pace?
It's kind of at their own pace. We don't have any kind of time frames for them. Now, the emergency beds, obviously, those are 90-day beds. And my double room is kind of for that emergency person who isn't on disability but got a job, but they still haven't been able to hold more than 20 hours. They can transition to a $400 a month room until they are ready either to go into my single room or go out into the community. But I do help quite a few of them find apartments when they're ready to move, but I never make them feel like, you know, you've got to leave type of situation. Otherwise, they'll be back. And we've had people back 2-3 times back into the house after they go out into the community because, again, they don't take their meds regularly.
Can I just add to that? I called Chris yesterday just for clarification on a few things before she presented today. I did tour Chesler Hall and met some of this just very small amount of staff and met some of the residents, and I think that, yeah, they're doing a great job with the program. I just want to clarify that the people that she takes in, they are all on mental health medication, so it's not my concern in this proposal was it was going to look to the board as a homeless shelter, and it's not. It is transitional programming for women with mental health issues, and they're all on medications when they come in. Or, you know, there may be certain cases where they are waiting for medications, but they can take them in, and then they're still working on getting those meds for the individual so they can be stabilized. So.
I've actually had people refuse to take their meds, and I said, you know, in order to live at Chester, you have to take your meds. So that is a requirement to live there.
Good for you. I'm very.
And that same individual went out for a couple of years, got arrested, had all sorts of things. Mercy's now holding her. Dr. Dean's waiting for a bed back at my facility because she is not compliant to meds.
And the reason I say that is I think that's a big factor in the system that we're currently operating under, and the recidivism of what happens here. They feel like they're doing better, and it's human nature to say, well, I really don't need that anymore, and so for you to be able to follow up and insist, I think that's something that we need to, as a state, even pursue, because I think we could really cut down on our recidivism if we had the ability to do that. So I compliment you on that.
Mental health. So when I see a resident, maybe the med's not working, or you know, we make sure they're not cheeking the med. You know, Stewart Mental Health and Dr. Muller's office, two places that most of my residents go to. They're very good. We get releases signed, and I work with them to say, hey, this is not what the person has. They're, you know, we need to increase or decrease, but here's the symptoms of what's going on. And so they've been really great about helping as well.
I really feel like that's very important. So, thank you.
Chris, maybe I missed it. I thought one of the benefits of going to Rolling Hills to have them pay for it instead of the state was you could extend it beyond 90 days.
Yes, that's exactly what I put in the, that's exactly what I'm saying is it's 90 days and they've got to move out, whereas with, you know, if Rolling Hills holds the bed, some of those folks that really need to stay there until they, you know, they could be a year from disability, or, you know, they've got a court hearing coming. With the state money, it's more of a 90-day term. So that's why this would be better, because we know who they are. You know, we know the people that really do need a roof over their head until they can get the funding that they need.
I want to make sure I understand the funding correctly. The emergency bed, whether or not we approve that, is budget neutral if we approve the other one, because it's just a shift of money, is that correct?
Yeah, well, if I was completely full, the maximum amount for 19 women at that per diem would be $64,000. If you take on 20 for the emergency beds, then we'd only be billing 17 women at the 924, which would roughly be
57,334.
yeah, plus
The 20,000.
the 20,000.
Two beds. That's what you got.
Okay.
77.
So it kind of only, I'm only, I guess, asking for 13,000 more, because we wind
Somewhat
up
less.
deducting
Somewhat
2
less.
FTE
Okay.
off the per diem.
But it wouldn't be worse. Okay. Now I understand it. Thank you.
Yeah.
Any other questions?
And this is, right now, I mean, it's region-wide. It's not just out of Sioux City, or
Right.
it can be,
I get calls from
From-
everywhere, yeah. Because there are limited transitional.
What? This has not been asked. What's your waiting list?
I'm sorry?
How big's your waiting list?
I only have 3 on the waiting list right now.
All right, thank you. Next one is the ARC of Woodbury County.
Good morning, Jim
Morning.
France. I'm not Dick Owens, as it says in the report. We finally got him to lay down this week and try to get over his pneumonia. So, I serve as a board member for ARC of Woodbury County, and our support has been for the intellectually disabled, and that's what ARC is. ARC is a national organization in which we have a membership, and then also a state organization, the state of Iowa ARC, and it's designed for advocating and providing programs and services for the intellectually disabled. I got involved with this about 4 years ago, because I began to understand that we have a certain amount of our population that has a real serious potential for a gap in their educational performance as a result of no summer school or any types of activities that are involved there. ARC is actually, in Woodbury County, has been doing this for over 40 years in providing programming that helps address that recognized gap where individuals that have intellectual disabilities suffer both mental health and or educational fallbacks as a result of no activities during the summer. The information, the research suggests that students, and we're talking through age 21 here for these particular group, have as much as a 50% fallback in the skills that they learn during an academic year. In those 3 months of the summer, they lose as much as 50% of those skills, so that when they go back to school in September, they're 50% behind where they left in May or June at the end of the school year. And so they have to rebuild. And you can imagine after 5, 6 years of elementary school just how far some of these students have a potential for falling back. And the results, as according to the data and information, is that this causes both a emotional strain for mental health issues. It causes required additional medications for these students, as well as the educational learning that is a part of what we need to do to provide these people with some type of sustainability, self-sustainability skills to deal with their life skills and necessary skills to continue on in life. What I felt the strongest about in ARC was, when I got involved 4 years ago, was that what ARC in Woodbury County has done is, as a result of joining Sioux Rivers, we have collaborated or partnered with the families of intellectually disabled students in both Plymouth and Sioux County. And so this last 2 years, 2017 and 2018, the summers, we've had not only Woodbury County young people, but we've also been able to bring those people down from Plymouth and Sioux County. I tell you that because part of the thing is we have a huge amount of equipment that we've purchased and built as our assets for the organization, and being a volunteer that helps unpack those every June for school and repack them at the end of July, we have a room about half the size of this facility right here full of our supplies. And it's everything from electronic equipment, tablets and that type of thing, to tricycles for helping with their physical disabilities and learning to balance and all those kinds of things. But it is a significant amount of equipment, and what we were able to do with Sioux and Plymouth County was invest in transportation for those people to come down and be a part of us, rather than try and build sites at Lamar's and Sioux Center, let's say, those types of things, and provide the training more centralized. And that's worked better for both of us, because there's a significant amount of investment in those assets that we have around the equipment that's necessary. The other thing that the program does is it uses certified teachers as well as an additional staff that receive the training necessary to be aides and support staff for the programs. And so we're running a program that's a curriculum-based, it's a nationally certified curriculum, and what we have is available to us then as a result of using that curriculum is that we have a set of data based on the standards, the national standards that are used for the intellectually disabled, so that we're able to recognize what we've been able to accomplish as a result of that. I happen to be a proponent of iStart, and so I congratulate you on choosing iStart. I talked to the people, to Dawn when she was out here a month or so ago, and talked with Dick and I about where you're at with iStart and those kinds of things. And I think, having been an executive director of a nonprofit for 10 years, data is probably the best thing we have going for us if we use it to make good decisions. And I think ARC is a prime example of using good decisions to make sure that we're making a positive effect on these students, both in terms of their social skills, their mental health skills, and then, of course, their educational maintenance of their educational skills and knowledge that's necessary for life. What you have in this proposal is our budget for 2019. Based on what it cost us or what we got for income in 2018. We're in a situation where our program runs over 2 fiscal years for mental health dollars. So what we have to do is start a program in June of 2019 based on two facts, is that we want, that we and believe that we'll continue to get support for these people from our mental health dollars, but also because you'll see there that we've built up enough assets that we can get through that second month if we have to on the assets, but then we'll be out of business as a result of it. That's just the bottom line. We can get another year of the program as it is now, but we don't know where Plymouth and Sioux County are going to be as a result of all these decision makings. We don't know if Rolling Hills, all your counties might be interested in being in a program, those kinds of things. Those are things that we've got to work out as we go ahead, as we move ahead in this whole process. But it is a very important program, and for Woodbury County, it's been a very important program, ongoing program for over 40 years, making a difference in the lives of our families of intellectually disabled young people. Questions?
I've got one.
Go ahead, Cecil.
If you've been in business for 40 years, prior to the startup of Sioux River's mental health region, what did you do to supplement your income to replace that $60,000 that you're getting from Sioux Rivers?
That's why we used the 2018 budget. United Way has been a big supporter of us, and so they've been a continued supporter of us. We do fundraisers. The families are principal in Plymouth and Sioux counties. The families came up with a plan to put transportation together to get their young people down to Sioux City. They put the schedules together. They organized the kids to get at one point to travel to Sioux City each day. This is a 7 to 8 week program, and so it's not just a couple weeks of summer camp for 2 hours in the morning. That's what it started out 40 years ago in Woodbury County. But it is last summer it was a 7 week, 8:30 to 2 program on a daily basis, and we brought all those people in based on the funds that we have. We've had a couple of supporters that made significant donations. You can see we have some cash assets from all those resources, and we've just spent wisely.
Well, I guess my question is, with the possible realignment of the mental health regions, if you lose Plymouth and Sioux, you're going to lose some kids, and if no kids from the existing Rolling Hills come to Woodbury, you're going to service fewer people. Is that correct?
Yes, right. Back down to what we were at, around 70 to 75, 80 each summer prior to Plymouth and Sioux County joining us in 17.
So is that $60,000, does that reflect the idea that you may be servicing fewer clients?
We think so.
Okay.
It's a guess at this point, but yeah,
Okay.
that was the best number we had to give you
Okay.
as far as what our budget could be. We're open to. I mean, we've been talking to ARCs in this area for the last couple of years. We even had ARCs from Dakota County and Nebraska talking with us about becoming a part of it at some point too. So we look at all those options, but what we could give you was
What you had for history.
What we think it'll cost us.
Okay, thank you.
Any others?
Well, I'll just piggyback on that a minute. I mean, and again, the realignment with the region, we can go back to Cecil's. If you still already have some clients or folks coming from out of Sioux Rivers, would this be something that we would look forward to partnering, within the future, partnering with them to keep would you still go back to Sioux Rivers and ask them for funding as well, or if that's where some of your kids are coming from?
This is Jim Franson now.
Okay.
Best estimate is yes to all those things. I mean, I know that our families in Plymouth and Sioux counties are excited enough about this that they're going to want to continue to be involved in a program. And wherever those two counties decide to join, if this whole thing evolves, probably wouldn't have a program. So the families are going to want to continue to get those services and reach out. We'd be open to partnering with those counties as well. I'm sure that they would then go to their regional health regions and ask for support as well too. Our concern is that doesn't happen overnight, and so this 2019 is a real swim in the dark type of situation. So you got our best estimates here. I put them together too, so I tell you about our best estimates.
That was a good and legitimate question, that if you continue to receive clients from that area, that you could consider
We've grown on
partnering.
partnerships. It's not just been Woodbury County, it's been other counties. Plus, they recognize that we have the resources, both a good group of certified teachers and other support staff, as well as families, that support it. And so other counties have continued to look at us. It's we just have a population base sufficient to keep the organization going. The other counties, used to be all 99 counties had ARC associations, and they've kind of dropped by the wayside because there weren't family members that continued to keep them and supporting them. And so they're looking to Woodbury County as a resource for these kinds of opportunities for their intellectually disabled members, as well as to keep the organization going.
Do the local schools have summer programs also? Is this over and above anything they'd have, or?
This is over and above. Kim can probably answer that question better. I think they've got a couple-week program extended for IEPs.
We do have summer school programs in Sioux City schools for K through 12. This would be through the special education program for the students, and that would be an IEP process where an IEP team would determine that there would be a need for extended school services or extended school year is one avenue, but then also we have summer school through the month of June and into July. This last year it was 6 weeks long for K through 12 students that qualified on the other side of things.
Thank you.
Is there any charge to any of the families that send their kids to the camps?
There's a basic charge per family or per individual there, but we have a sliding scale fee, and better than 50% of them are at-risk families that qualify for no cost. So there is a minimum program services fees of $6,250 is the estimate in their income. That's what we received in 2018. Is that right? Yeah, $6,250.
Any further questions? Thank you. Next one being Siouxland Mental Health Center.
Hi, I'm Nancy Teeman, I'm clinical director at Siouxland Mental Health Center. I'm here to talk about the Safe School Therapy Program. We currently have 4 licensed master's therapists in the school district that provide evidence-based practices for the kids they serve. Some of those include trauma-focused CBT, play therapy, solution-focused therapy, strengths-based therapy, or play therapy. We're currently in 13 schools. We're the Sioux City Community School District, and also in the rural Woodbury County schools. School therapists provide a minimum of 157 hours weekly at the schools they serve, and a lot of these kids, these services would not be available to them if we were not in the school due to a number of different reasons. Excuse me, the rural schools, because there's no access to services, and even within the Sioux City Community School District, different areas which include maybe transportation issues or single-parent families that the parent has to work and can't get their child to the main clinic. So we use the school district or the school therapist for a last resort. If they can come to the clinic, they haven't come to the clinic. If they can't make the clinic for whatever reason, we see them in the schools. So we're also, in addition to therapy, the clinicians will sometimes do case management or crisis assessments at the school. help school counselors with different assessments at that time. And we're requesting $127,337 to cover the difference in the program costs. Anything else that we can add?
Just so it is understood, we do bill Medicaid for everybody we see that we can at the school. So this is, the Medicaid funding is subtracted from the total budget that we're requested. So, and that's where we get down to the 127,000.
People serving doing this, what qualifications do they have to have?
They're master's level therapists, either licensed mental, or licensed independent social workers or master's level counseling, LMHCs. So they have to be licensed in order to provide therapy, licensed master's level, in order to be able to do therapy.
So you indicated that you were billing Medicaid when possible, which you need to do. If I'm looking at this correctly, there's then no school district participation in this program. Funding?
Not in this 127,000, no. The school district does make available to us their Project Aware funds right now. But as I understand it, the Project Aware funds will be expiring at the end of next year. So yes, this is just our total budget minus anything that we project we might be able to build through Medicaid or any of the commercial insurances we've been able to work with.
Okay, thank you. Any questions or comments?
As in the past, most of the programs we funded, we tried to be treated as a region program. So if this were to continue, would Siouxland Mental Health be willing to extend it to all the regional schools?
Well, we definitely would have to hire more therapists to be able to reach additional schools. We're running a full caseload now with the therapists that we have, but obviously we would try to do everything that we could to meet that need.
Go ahead.
If you remember, for budget negotiations for last year, our school-based funding was cut for this year that we're in now. Because of the impending Woodbury County coming on. And they had a huge school-based budget. So I'm just going to raise that concern that we agreed to cut our funds for school-based services.
I recognize that. That's been on the radar. So thank you for bringing it up. But yeah, I mean, we understand that. And I would support what Dennis had said. In these programs, we have done our best to make them region-wide to be consistent, and that has been important to us. So this is difficult. So, thank you. Any further questions, I guess?
In Carroll County, we have Lutheran Services of Iowa is funded by different funding mechanisms to provide this school-based mental health services. It's not funded through regional. It's through our community partnership for protected children.
Oh, through DCAT?
Yeah.
Oh, is there?
So I was wondering if any of those funds would be available in Woodbury County. I don't know what their situation is there for DCAT funding. Lutheran Services Iowa does the work in the Carroll County schools, and it's through DCAT funding.
Well, we received DCAT funds for Denison, for Crawford School. along with some monies from the Crawford School District.
Yeah. Is that money available for the ERC?
It's very, very minimal, and DCAT funds continue to increase.
I was DCAT coordinator for 10 years in Woodbury County before I retired, and each county chooses their boards choose how they use those funds. So, you know, it's not impossible for an application for that, but they've chosen other areas to fund, where your county has chosen it for the school-wide mental health claim. So I guess that's not a yes or no. It's just it could happen, but their funds are not currently, as far as I know anyway. I haven't looked at this next year's budget, but as far as I know, they're not having any of it available used for mental health assessment in schools.
One comment I would like to make is that if we consider doing school-based therapy, I'm going to advocate for this area to have their funding reinstated, or we would take a look at what their actual need is. Because I think in talking with Kim, what has been cut, they're still operating at a deficit, even though you're trying to bill Medicaid for those that you can. So if we're going to do this with Woodbury County, we need to be fair to Plains area as well.
And we have 3 more requests from other school districts for school-based service that we just can't do right now because, for one, we can't find therapists. Another, I mean, we just can't afford it. So.
And part of my question, and qualifications is that person doing it in Carroll County is not totally licensed, but they're working under a licensed person. Only because we couldn't get a person with a master's in this correctly degreed, I guess.
Lisa, how does South Central, when we go through Berry Hill, is that through insurance? and
They
Medicaid?
bill as much insurance as they can, and then, I don't think the school participates at all, but I was thinking to myself that South Central will be very interested. They have somebody definitely in the elementary, and they really need somebody in the middle school.
Doesn't the Van Holzen gal serve in that capacity?
She's not a therapist, though. She, I think social
Okay,
work.
I knew she did something.
Yeah. And she does a very good job. I mean, works with families, and I get phone calls often from Teresa, yeah,
Okay.
so.
All right, any other questions? Thank you. Next one is Sanford.
Good morning. Sanford Center's requesting funding for continuation of our mental health program, prevention program, in the amount of $260,733. Brief history about the Sanford Center. We have been providing mental health help to these children in the context of family, schools, and community. In 2004, we shifted to the Sioux Rivers region, where we provide Category 1 mental health services. Sanford Center program is an evidence-based program where some of the things that we track is mental health illness, graduation rates, suspension, delinquent behavior, drug use, school dropouts, bullying, and juvenile delinquency. Our outreach workers have a 4-year degree, and those degrees are in psychology, sociology, juvenile justice, and a master's in behavior disability. And if they don't have a degree, these guys come with 15 to 25 years of experience. One thing about our Sanford Center program is the workers are placed in the elementary schools, middle schools, high schools. And once we get that kid in the elementary school, we keep those kids all the way to grades 12. The workers in the school where they're able to suppress some of the situations that happens in the classroom, or if a kid comes to school with some social issues or some things that happen at home, that worker can in turn pull that student out of that classroom, work with that student to get them back, calm down, so they can go back into their classroom and continue to study. Also, we're able to get into the homes, connect with the family. Whatever information we find from the family, we can in turn bring those information back to the schools to figure out a course, a plan how we can work with these kids. Our kids are referred to us by principals, school administration, counselors within the school. So we're not making a referral. We are giving the kids that need to be worked with. The unique thing about our program as well too is the relationship aspect. As we know, when you talk about mental health and some of the communities that we do serve, it's a broad stigma in terms of reaching out for mental health. So because of our diverse workforce, we're able to get into these homes, but at the same time, get these families to receive the treatments that they need. You have our package in front of you, so I'm not going to go into some of the statistics that we do have, but we've been doing this since 1992. We serve over 300 kids in the Siouxland area. And without this program, those kids would lose services. So it's something that we know that's needed in our community. And we want to work hard to continue to keep these services going for these kids and families.
Thank you. Any questions?
How much did you ask for last year from Sioux Rivers?
$260,733.
Same
thing. But initially, we spent about $338,000 to run the program. We have, the Sioux City School District has afforded us space within the district to work with our kids. They give us office space within the district to work with our kids too. And then also, we put an additional $35,000 ourselves to continue to work with these students. As we know, as insurance premiums are coming up, as we look at budgets, we have to look at a 25 to 33% increase. So that's going to raise what we can, what we have to charge to keep this program going. So.
Anybody else?
Do you get funding from Northwest AEA?
No, they don't use it.
You don't?
Most of our funding from Sioux Rivers right now, and then also we do fundraisers as well to offset some of the costs too.
Prior to 2014, you're receiving DCAP money?
Yeah. And then a lot of the money went away, so.
Have you applied for DCAP money since then, though?
We have applied for it, not.
Anyone else?
About juvenile court services.
Actually, we've been talking to juvenile court services to see if there's some funds available. The latest estimate, maybe 15 to 20,000 right now. So we're searching every avenue to stay at that 260,000. We're not asking for increases, asking to stay where we're at, so we can continue to serve these kids. We have 5 outreach workers that's employed, and then also we have a supervisor that actually oversees that program, and we have an educational coordinator that actually goes into the schools and work with our kids on the caseload.
Do you do fundraising efforts in the community?
Oh, absolutely, absolutely. In fact, we're running a fundraising effort right now. Friends, Family, Better Life campaign. That's a social media campaign. Also, we do one of our signature events is at the Orpheum this coming April. It's another big fundraiser as well too. So we're trying everything we can to keep the doors open.
Thank you.
I gotta apologize. Just back of my mind, for some reason, $560,000 sticks in my mind. Is there something else that Sanford Center asked for? Maybe not. Okay.
No.
Anyone else? Sioux City Schools.
Good morning. I'm Kim Buryanik. I'm the Associate Superintendent for Sioux City Schools. We have 2 proposals that I'll speak of on one and then the second one after that, if that's okay. Just a little background. In 2001, the Sioux City Community School District received federal grant funds for the Safe Schools, Healthy Students Initiative. The grant funds expired, and the Sioux Rivers Regional Mental Health and Disability Services has annually provided funds for the continuation of the programming related to the mental health components that were contained within the grant. The Sioux Rivers Regional Mental Health and Disability Services has provided $205,000 annually to the school district to use for school-based mental health therapy services provided by Siouxland Mental Health. In 2014, the Sioux City Community School District was awarded a SAMHSA grant, Now is the Time Project Aware grant. The grant will expire in September 2019. A large portion of the grant serves mental health needs of students in the district. The grant has paid for school-based mental health therapy costs in 2015-16, 16-17, and 17-18, and is paying for costs this current year as well. The cost for school-based mental health therapy has increased each of those years. In 2015-16, the cost for school-based mental health therapy was $38,000, just under $40,000. And that's in addition to the Sioux Rivers funding that we received for the Siouxland mental health therapy. In 2016-17, the cost increased to just under $170,000 a year. And then in 17-18, the cost was $258,000. These costs, like I said, are in addition to the $205,000 that is allocated to Siouxland Mental Health through the Sioux Rivers Regional Mental Health and Disability Services. So our first proposal is asking for $500,000 for the continuation of the funding for school-based mental health therapy for students that do not have private insurance or qualify for Title 19. And since 2001, this has been a service provided to families and students funded by grants or Sioux Rivers Mental Health Therapy, Sioux Rivers Regional Mental Health and Disability Services. So what we'd like to see is an RFP process where we are developing an RFP that agencies can apply for. We would stipulate the services and the type of needs that we have, and then award the contracts or the agreements based on that. And the second proposal is similar, and it is, we had again that in 2001 a federal grant, the Safe Schools Healthy Students Initiative, and we have received annually $260,600 through Sioux Rivers Regional Mental Health and Disability Services to for preventative outreach specialist services that are provided by the Sanford Center. And then in 2014, we received the SAMHSA grant again, which will expire. But through that grant, we wrote an RFP and awarded it to the Boys and Girls Home and Family Services. And the RFP included payment for consultation services provided to the school district by clinicians that were not billable services. Teachers in the school district, we're experts in the classroom and teaching students how to read and different things, and the mental health needs of students, we need that extra help from experts. So we're really pleased with that approach that we've developed and have been utilizing since 2014. We expanded it beyond the Boys and Girls Home. There are other agencies that are working with our staff. They're attending IEP meetings, they're attending attendance hearings, they're coming to meetings with the staff and providing their expertise. And we have increased the amount of money we were paying to these agencies for those non-billable services each year for the last 2 years. And so we are asking for $277,600 for the continuation of funding for mental health experts to consult with school personnel regarding student mental health challenges. And again, we propose that an RFP be established or created to establish the parameters and then select the service agencies to provide those services. I'd be happy to answer any questions.
I will just offer a comment.
Sure.
As a taxpayer and as an individual, I understand how important these services are, but it's disappointing to me as a state that we don't offer an avenue through education to provide these dollars. I really, at the end of the day, I feel like it should be something that the state does to offer each school system the opportunity to address their needs and the avenue to collect money to do it. It's really disappointing to me that we don't do that. Understand the need. I mean, I certainly do, but also I feel like we ought to be allowed to collect that money through the educational process to provide that. It's disappointing to me as an individual. So, thank you. Any questions?
What is the enrollment of the Sioux City School District?
We have just under 15,000 students enrolled in K through 12 in Sioux City schools.
Thank you.
You're welcome.
Neil, do you have something?
Is there any overlap? I mean, we've got the Sewell Plan Mental Health Center with school-based mental health. We've got the Sanford Center, which works in schools and also reaches out to home. And here we've got the community school district that has mental health clinicians supporting the staff, et cetera. I mean, say a person is in the Sioux City school district and they've got mental health issues. What's the situation? Is there an overlap or not?
Is there an overlap in the requests?
Of the services.
Of the services. We work closely with Siouxland Mental Health as well as the Sanford Center, and sometimes the same student is receiving services, attending our school and receiving services at both the Sanford Center as well as probably being referred to the Siouxland Mental Health. So there is some overlap. There can be. We had 648 students receiving mental health, school-based mental health therapy services last year.
That's the number that you have.
That's the number that we had. 48% of those, over 300, did not qualify for Title 19 or have private insurance.
So about half.
About half. 48%, yeah.
Well, in terms of overlap, I think that needs to be clarified. Because of the tight time frame, I think that the school district was trying to get the proposals to us by the deadline of October 31st. So they submitted and included the request for the continued funding for Siouxland Mental Health as well as the outreach through the Sanford Center. But yet Sanford Center and Siouxland Mental Health presented their proposals so that they were all available for consideration by the deadline. So they're embedded within their request at the school district level, but then we do have Sanford Center and Siouxland Mental Health that are making their own requests. So keep that.
So they are duplicated.
Right.
Okay.
Well, I just want to say one thing though, is that there's no guarantee that Siouxland Mental Health Center would be the provider for the
True.
school district because they are going to have an RFP.
That's true. Good point. I was going to ask that because with the RFP process, you may or may not.
May or may not
Yeah.
be the provider.
And with the RFP, we would anticipate that we'd have more than one provider through these RFPs just because one agency isn't able to provide enough. It doesn't appear that they can provide all the services that we need.
I got a question on the process because the AEAs do employ mental health professionals for testing and evaluation. So what's the gatekeeper here on deciding whether they receive services from AEA, or how does that whole system work?
The Northwest AEA does not employ a psychiatrist, I don't think, to provide, medication, prescriptions, or diagnosis for mental health. They employ the psychologist to do that academic-based testing.
Did they just do the testing and then referrals happen after a testing process?
And that's just the academic side. It's not the psychiatrist side of things, mental health side of things.
But they're tied together. If they have, if they have mental health problems, they're a problem in the classroom, which is basic education.
Sure.
My wife did work for the AEA and was contracted to do work under Safe Schools, so I'm a little familiar with some of what they do, but I just am really confused as to who's providing services and where does AEA leave off and where does the the mental health professionals enter into this picture.
Thank you.
You're welcome.
Any other questions?
So Don, I just want to ask one more time, that 500,000 that the school system's looking for has Sanford and Siouxland mental health included in it?
The way,
That has-
Sioux Rivers, no, the Sioux Rivers region provided for 500,000 to this, directly to the school district. And Sanford Center, as well as Siouxland Mental Health, billed monthly to the school district for the services that were provided, up to that 500,000. So they were the fiscal agent for the Project Aware grant. And so that covered the two programs, the 205 and the 277.
Yeah, we're not a part of the Aware grant.
Right,
Yeah.
no, you're not part of that, but that was the money provided by Sioux Rivers, and then the school district over and above that received the Project Aware funds, which is ending in September.
Another
13th.
$500,000.
Well, 200 and,
Oh, was it? Okay.
well, the 277 that they're requesting is for outreach.
Right, which would include the Sanford Center.
So the 205,000 that went to Siouxland Mental Health Center, while it went directly to the school district, Sioux Rivers, that was for therapy provided by Siouxland Mental Health. So up to that 500 in their request is the replacement dollars for the federal grant funds.
For,
Project Aware.
and for the mental health therapy that Siouxland Mental Health is providing through Sioux Rivers. Both of those are in the $500,000 request. And then separate is the outreach workers, the non-billable hours, those support personnel, which is the Sanford Center, and then the other part of that federal grant, the SAMHSA grant, that we were using to pay clinicians to work with our staff members. And that was the $277,000.
Okay. Any further questions? Hearing none, thank you for the time spent in the conversation and trying to educate us on what things are used for. Did anybody from Woodbury have any input or comment?
I guess from Woodbury County's perspective, we're appreciative of the process that you're asking the questions in anticipation of budgeting. We've been trying to explain that process a little bit, and just to reiterate, on behalf of Woodbury County, we're fully committed to covering our costs. We don't expect any dollars further and above what we're able to provide. So whatever decision is made, we're appreciative of, as far as recognizing the need for school-based services, but also the balancing act that you have as far as, operating that as a region. So just wanted to reiterate, we're appreciative of the process and fully intend to fund whatever it is that's laid forward as a region.
Great, thank you.
Jeremy, we'll probably have more information next month on this that Don put together, but with the core and these non-core things, will that all fall within your 3.1 million?
Right, we anticipate having a little more granularity as Dawn digs in with our budget analyst and our current coordinator to make sure that whatever we are able to look at as far as that total budget, we're fully able to cover all the costs of. We don't expect any of your 7 counties to subsidize $1 over and above what the cost of our services would be. We've never expected that, nor should we.
No, but that's not the way regions operate.
And I understand.
It's a regional system. If the region has needs, when the money all gets thrown in a pot, then you prioritize your needs, and it's based on what the region needs, not not that we expect every county to kick in. Cherokee County kicks in $500,000. We expect $500,000 of services back in the county. That's this region has never operated under that system. I know Sioux Rivers, when they first started, tended to try to operate under that system. So, if they still are, this is going to be kind of a change, because regions are, that is a group. It's not individual counties. We're a region.
Mm-hmm. And I fully appreciate it. I just wanted to let you know from a fiscal aspect, that's not our hope or our expectation isn't that there would be subsidization, although I understand exactly where you're coming from.
Well, I want to piggyback onto that because I think where Jeremy's coming from is that we made it clear for the first year that they had to cover their expenses so that we were spending down our reserve at the same time to that 25% level. So I think that's why he's pointing that out, that we do not, he's not intending for us to subsidize. So I think as far as the budget process is concerned, I do have a budget from Patty Erickson-Putman, who's their current coordinator. She and one of the staff put a budget together when Woodbury County was seeking their exemption last spring. I had been working with a figure of $4.1 million for Woodbury County with the reductions down to 3.3. Patty was able to project the budget at 3.2 million with all of the existing services that are being paid for in Woodbury County through Sioux Rivers. So the numbers that I have from Patty can be covered under that 3.2 million. 3.3 was our target. I just want to meet with Patty and probably Dennis or Jeremy and make sure everything that is encompassed in there is included, and that I need to find out what has been reduced in that budget, because I think there were some concerns that maybe things were pulled out of that in order to meet that target, but yet I'm not 100% sure what those things are. But I think that we're closer, and obviously with the per capita changes, when Woodbury County comes in, they're going to be able to levy to be able to afford the services going forward.
Okay. Any other discussion or business that anyone wants to?
Long-term sustainability.
None of the regions are sustainable long term with what we have right now at the 20 and 25% service for cost reductions down, fund balance, down to that 20 or 25% by 2021. We're all going to be out of money, and we're not alone. And I think that that's why our charge is right now with the legislation that we have to build these core services, and hopefully we can make some changes this next session to repeal that restriction on our fund balances, because we're not sustainable at 20%.
It's one of the top ISAC priorities.
Mm-hmm.
20.
And that consideration would have been difficult moving forward without the last year's legislation. And now with that, with all the build-ins that you're having to provide, it's just not possible.
Mm-hmm.
You don't have to be a budget analyst to know that. I'm fairly good with numbers, but I was just amazed that they could suggest that you would start additional programs, and by the way,
spend your money down.
Yeah, spend your money down. One-time money just wasn't a good thing. So. All right, any other discussion? Hearing none, our last bullet point is our schedule for the next meeting.
It'll be November 21st.
21st.
Time and location will be determined, and Paul and Rick and I will work on the details and send something out as soon as I know.
Thank you, everyone. I would entertain a motion to adjourn.
So moved.
I have a motion and a second. All in favor indicate by saying aye.